Important for you, please pay them the minimum basic which is recommended by the committee formed under the supervision of Supreme Court in 2016. That's a 20,000 salary. None of the state has a dareness to implement that. And you are asking nurses to work in this time? Second, regular recruitment of nurses in the government sector. Government itself is responsible for not recruiting the nurses in the. There is a lot of nurses availability. There is a supply of 2 lakh plus nurses are supplied every year in means produced in India, and are they recruited is a question mark. Now sanctioning the hospital only with nursing sanction post in the government hospitals, and following the nurse patient ratios is one of the basic standard of care that should be included in NABH and ACI. National accreditation of a board of hospital says nurse patient ratio is not important for, is not a quality indicator. Then who will provide the quality? A institution? A best building with the marbles, or what? So I say again, if skills are important, so nurses should be paid the due financial incentives what they are not they did not get since long, and their hard skills. What are their skills should be now. There are many people who are saying that nurses are the only are best in working ICU. They know everything. Then why you are not promoting as a nurse specialist in the within hospital? These are questions not to ask during the COVID, but COVID during the very important question to ask. Nurses are also human being. They are not angels. They are not angels. Let me repeat. Nurses are not angels. Nurses are also human being. Please treat them as a human being and give their minimum basic requirement. That is a minimum basic pay, a good standard job, and added to that the importance for the skills. With this, I again appeal the government of Delhi and other states government and Ministry of Health and Family Welfare to recruit the nurses from their merit list which they already have in their hand. Please do not recruit the nurses on the daily basis or short term basis, and I have shown you video what happens when you do so. The many nurses come up and they come in large number because they are need in job. They have a hope that once I get into the job government sector, I may get permanent. I may get. They all are. Nurses are the basic bread earners for their family. So please recruit them on permanent basis, not on the short term basis, and don't use and throw them, please. Suppose if you recruit any nurse for only daily wages basis or 3 months or 6 terms months basis, 3 or 6 months basis, then what will they do? After that, they will go. Where will they find the job then? And there are also proposals to stating that nurses should be compelled to work in ICU. No, there was a proposal stating that nurses should be made compulsory to work in the ICUs, private hospital ICUs, and they should be given a grace marks in the uh, government jobs. No, there is no shortage of nurses in uh, India as per now. There are many nurses. You need to pay them more. They will come and work in private hospital. They don't bother which area. They will work in ICU. Yes. They will work in other stations. Yes. But once we agree stating that if nurses work in ICUs, they will be having a more grace marks in the government hospitals. That is going to reduce their demand, and private hospitals will definitely exploit this situation of stating you come and work in our ICU, you will get a grace marks in your government sector jobs, and they will be paid less, very, very less. And this type of trick should not be allowed during this pandemic. This pandemic should not be, this situation should not allow private sectors to exploit the nurses in the name of COVID. With this, I thanks for I thank you for watching this long video, and also request, if you have any comments, please do comment and do share your views and ideas on resolving the nurses shortage if it is there in the during this pandemic. And I request you all, be safe, stay home. When you have any symptom, please go immediately get tested, isolated, and monitor yourself. There's a monitor yourself for fever and any symptoms and get treated. Thank you. Be safe, be healthy.